This is on the effectiveness of psychoeducational programs for caregivers of family members with chronic disease. And this is a meta-analysis by Hadiye Kucukkaragoz and Ayca Ilgaz. And this is a brief outline. What psychoeducational programs are is, it is basically when caregivers take care of their family members with chronic diseases, there's a huge burden on them. And these psychoeducational programs aim at reducing the stress and the burden of caregiving. The background is as follows. Advancements in medical technology have extended the life expectancies, increasing the prevalence of chronic diseases. This scenario underscores the importance of informal caregiving provided by family members, friends, or relatives without financial compensation. The caregiver's role and burden are vast. Caregivers play a pivotal role in managing chronic diseases, which includes a wide range of responsibilities. However, this also leads to significant physical, psychological, and emotional challenges. That is why there's a need for psychoeducational programs. In response to these challenges, psychoeducational programs have emerged as effective interventions. These programs aim to provide caregivers with information, skill building, and support to manage caregiving stress. The aim of this research is to evaluate the effectiveness of these psychoeducational programs in Turkey, specifically their impact on reducing the caregiving burden. The methodology is a meta-analysis research framework. It involves systematically collecting quantitative results from various studies to infer the general effect of psychoeducational programs on caregiving burden. The research sample was 9 previously conducted studies in Turkey. They were primarily master's thesis and consisted of large samples, and this meta-analysis involved all of these 9 studies. The inclusion criteria were met. The data analysis was done through the JASP software. The findings reveal a diverse range of psychoeducational studies with a significant focus on caregivers for schizophrenia patients. Most studies involved 8 sessions, indicating a common framework for psychoeducational programs, despite the lack of standardization in session duration. The impact on caregiving burden was significantly reduced by the psychoeducational programs. This is the main result of our meta-analysis, our colleagues' meta-analysis, I should say. But the effect sizes varied. The broad range of effect sizes indicated diverse impacts of psychoeducational programs on caregiving burden. And the subgroup analysis revealed that the number of sessions did not significantly affect the caregiving burden, suggesting the importance of content over duration. The significant outcomes was considerable, suggesting that psychoeducational interventions effectively reduce the caregiving burden. The findings also underscore the significance of the content of psychoeducational programs in alleviating caregiving burden. The contribution to the literature is as follows. This is a comprehensive meta-analysis on the effectiveness of psychoeducational programs for caregivers in Turkey. And psychoeducation and family therapy, this psychoeducation aligns with the goals of family therapy by enhancing family functionality and supports caregivers in managing chronic diseases more effectively. In conclusion, the meta-analysis confirms that psychoeducational programs are effective in reducing the caregiving burden, supporting their inclusion in routine treatment plans for chronic illnesses. In terms of future research, it is suggested that the psychoeducational programs should be refined, focusing on the design and content to meet the diverse needs of caregivers across different settings. The policy implications highlight the need for healthcare policies and programs that acknowledge and support the crucial role of caregivers in managing chronic diseases. For more information, you can contact my colleague, Hadiye Kucukkaragoz at Aydin Edu-TR. Thank you.